know?
Yeah, I think you and I talked about this a little bit the other day. Yeah, they can come home and sit on the phone or do whatever, or, it's just it always seems to fall on our shoulders,
It does.
right?
Yep,
So thank
absolutely.
um, I know how extremely busy you are, so thank you for
Thank you.
joining me here today.
It's great. I watched some from the other, I didn't get to tune in live, but I watched a few of them. I have them all. I'm going to go through them one by one. I
Yes.
want to see the one from this morning with the stylist.
Oh yeah, she's awesome. She's so
Yeah, yeah,
I'm gonna upload all of those so people can watch them hopefully all weekend long.
that's right.
Okay, so for those of you that do not know Dr. DeNoble, she is the owner, and you can correct me if anything I say is wrong,
Okay.
Advanced Gynecology, which I discovered back when you were in Ridgewood. Now she has an office location in Wayne. And I wanted to have you on today because since it's a conference for midlife mamas, we're definitely all struggling with some of the same aspects of aging gracefully as we can, menopause, perimenopause, hormones, and also our sexual health. So, just to dive right into it, for midlife mamas our age, what are some signs and symptoms that one might that might indicate to one that they are in perimenopause, and what does that mean exactly?
Great question. And I'm so glad we're talking about this because as a country, we do such a great job with educating people about adolescence and puberty, but we really drop the ball when it comes to educating about menopause and perimenopause. So a lot of women are kind of stuck like, what's going on? Am I going crazy? What's going on to my body? There's so many changes. And it's important to know what's happening and also what things you can do to make the transition easier and to address whatever issues come up so that you're not completely changing and miserable. So, menopause is technically when your ovaries have released the last egg and you have your last menstrual period. So, really, it's almost a diagnosis looking at back retrospectively. So, once you've had your last period and then it goes about 12 months and you haven't had any more periods, that's called menopause. You're now in postmenopause. So, for the rest of your life, you're in the postmenopausal period after that point. The years leading up to that last period can be very erratic when it comes to menstrual cycles, and that's the premenopause or the perimenopause. And some of the things you might see, you might have hot flashes, especially the couple years before you stop or during the time you're stopping and you're skipping periods. Have a lot of hot flashes, which is really like a sensation of heat that starts more usually in the chest and it spreads. And then you sweat. This is the whole physiologic response to your body not regulating the temperature that well. And then you break out into a sweat and then you get really cold because now you've sweat, all the heat gets released from the blood vessels in your cooled off and then you get freezing. So you're putting on the coat, taking it off, so on and so forth. But the what you usually see before that is that your period, your menstrual cycle starts getting really irregular. They can get very heavy in some women. The cycles can get very short, meaning you might be bleeding every 3 weeks instead of usually every 4 weeks. You can skip some periods. So 1 month it's 3 weeks in between, another month it's like 5 or 6 weeks. And they can get, like I mentioned, very, very heavy. So that's another telltale sign when your periods start changing. Another symptom you might see is you might have difficulty sleeping. Weight gain is another really common thing that we start seeing, especially in the abdomen area. Women, it's easier to put on weight in that area, even without changing your diet or exercise level. You put more weight on in the abdomen area because with the hormone changes too, your metabolism can start changing. Your insulin resistance goes up. So when you were in your 30s and you could have, a bunch of cheeseburgers or slices of pizza and have a bunch of wine, now it really catches up with you and your body can't metabolize that as well. So those are some of the common symptoms that we see. Another thing we see sexually is you can start having vaginal dryness. You might start feeling like with intercourse or sexual relationships, you're more dry and you start having to use a lubricant with intercourse. Some women, not as often, it happens more about 5 years after that last period. You can start having pain with intercourse, which it can start becoming uncomfortable. And certainly sex drive, that libido that interest in sex can also decline. It can start really declining mid 30s, but really in the 40s as well. And that premenopause, it can go down.
And so is there anything we can do to combat all of these wonderful symptoms?
Changes? Yes. Yes, absolutely. So, when you think you're in perimenopause, so when you're still menstruating, but things are getting erratic, depends on what symptom you're struggling with. One of the best things you can do for your overall health is make sure you're eating healthy, clean, and also having some kind of physical activity that helps as well. In terms of the weight gain that a lot of women do experience, obviously eating healthy, making sure you have a lot more vegetables and fruit, you're having healthy carbohydrates and not other carbohydrates, having a lot of protein, just eating really healthy, eating clean, nothing processed, limiting the wine. If you do drink any alcohol, limiting how much wine you're drinking. You don't want to drink every night, have a glass of wine every night. That's a lot of sugar. Really watching your sugar intake and also exercising is really important. Weight bearing, there's two really kinds of exercise I recommend for women in the perimenopause and menopause. One is cardio exercise, so you're burning calories, getting your heart rate up. But the other is weight training exercise, because when you build up your muscle, which does go down, because with the hormone changes, another hormone that we don't think of in women is testosterone, that's declining as well. So your muscle mass is declining. And that affects your metabolism in a negative way, and then it changes your body composition. So the more muscle you're building up is doing two things: keeping your metabolism better, keeping your strength, which is really important, and also it's helping prevent osteoporosis, which does happen after menopause as well. So really, if you're not really in a good regimen of eating healthy and exercising, in your 20s and 30s, then really in your 40s, it's a good time to start to really get into that habit. So that's one thing you can do for your overall health. Sleep is extremely important. You got to make sure you're sleeping well. As women in this point of our lives, this is all happening hormonally, but also what are women dealing with in that same time period? If you have children, your kids are getting older, maybe they're getting into a little bit more trouble because they're now their teens, or they're older kids and you're dealing with the children, maybe they're going off to college and you're dealing with that. Your parents are aging, so you're also usually, as a midlife mama, you're taking care of them. If you're married, the relationship could be getting into a stale point, and that's kind of not as great as it was. Your career might be kind of taking off, or it's requiring more of your attention. So there's so much happening to women at this point in life. Plus, you got the hormone changes. So it's a lot. So you want to make sure you're managing some of the things you've touched on. You're managing, you're reevaluating, cutting out the things you don't need. It's adding extra stress to your life. Making sure you take some time to take care of yourself too, and then you can take care of your family better, when you're taken care of as well. You really have to kind of reevaluate your life and making sure that you're not doing anything that's unnecessary and you're able to focus on your well-being, meditation, yoga, whatever it is that really speaks to you, prayer, whatever it may be, to really recenter, fill up your own bucket, and then you can manage well. So all these things help this hormonal transition also.
I was going to say, that's really refreshing to know that all those things that we've been talking about all week can actually help with some of these hormonal changes. That's encouraging. That's good news.
Yeah.
Right?
Now, when it comes to what you want to talk to your actual gynecologist about, depending on what's going on, if your periods are really erratic, that definitely has to be evaluated. Because sometimes, with these hormone changes that are happening with the estrogen levels and the progesterone levels, some months when you're nearing the end of your healthy eggs that are being released, the progesterone levels might not be as good. So what you get is overly thickened lining of the uterus, because estrogen really feeds the uterine lining, makes it thicker, and progesterone keeps it in balance, and then you withdraw with a normal period. When that's going out of balance, which it does happen in your 40s, usually in the 40s, you're also at risk for developing precancer and cancer of the uterus, endometrial cancer. So that has to be evaluated. A lot of times we do a simple biopsy to make sure you're not developing anything that's precancerous that you have to monitor to prevent that. So that should be evaluated. And then if everything's normal, but it's really affecting you, I have women coming in saying, my car got fully bloody because I had this huge heavy period. I didn't know I was going to get my period. I bled through everything and I stained everything. And it's really, you don't want to deal with that when you're out and about and you're working. So things like low dose birth control pill or some other, there's ways to manage it, even an IUD, a progesterone releasing IUD really helps with that. So there's things you can do to help manage that transition period. And then once you're done with your periods, that's a whole other conversation about hormones, which we can discuss. There's many things you can do, but definitely hormones are one.
So yeah, let's jump into that. So then tell us, what can you do about the hormones after the fact?
So after the fact, one thing I do want to definitely discuss is hormone replacement therapy, HRT. There's a lot of misconceptions about it. There was this huge, and we have to go back to see where this came from. There was a huge study called the Women's Health Initiative that was looked at to look at women getting hormones, because back in, the 80s and before that, women were everyone was put on hormones, and they were put on estrogen and progesterone, which is the typical replacement is with those two hormones. Sometimes testosterone, and we'll touch on that. But estrogen and progesterone, if you still have a uterus. If you've had a hysterectomy, you don't need the progesterone part. But they looked at that, and the numbers that came out were really, scary. So everyone stopped hormones at that time. So the early 2000s, no one was on hormones anymore because they saw higher risk of heart attack, stroke, blood clots, and breast cancer. But now when you reevaluate that data and you really break it down by age group and look at some other factors, we see that it's actually not as bad as we used to think. So during that time period too, that everyone came off hormones, women started going towards bioidentical hormones, which many of you have, I'm sure, heard of. Bioidentical hormones just means that the hormones that you're getting as a supplement are identical molecularly to what's naturally in your body. But back then, it was marketed about hormones that are specifically created for you, kind of like designer hormones that you go to a lab or a spa, they do a saliva test or some kind of blood test to check your hormones, and then they make hormones that you need in, compounded, basically. And that actually we don't usually recommend. First of all, the blood testing that you can get to check your hormones don't actually reflect anything real.
Okay.
Because your hormones, especially like I said, it's erratic. So you can get it done one day, the next hour, it's different. So even though it sounds good, it sounds like, oh, great, they checked my levels and they know exactly what I'm getting. They're not steady levels. The other problem with these compounded made hormones is that, and they've been studied, they looked at 12 different compounding pharmacies with the same prescription and then had an independent lab evaluate them. They're not regulated by the FDA. They're not standardized. The vehicle that the hormones are in has not been tested for absorption and bioavailability and all these things that we need FDA to regulate to make sure that things are safe and it's really what you think it is. So you might be getting a treatment that is either not enough hormone, too much hormone, or in the scary situation of not enough progesterone and a lot of estrogen, you're set up for cancer, endometrial cancer and breast cancer. So that's what people think of when they think bioidentical. They think it's totally safe because it's from plants, which they are, but it's not like you're just slicing up a yam and rubbing the hormone on your skin. It's still created in a lab and it is synthetic, even though it's similar to what you normally have in your body. So people think it's safe and it's not safe. So what I like to use and what the North American Menopause Society and American College of Obstetrics and Gynecology recommends are bioidentical hormones that are from a regular pharmacy, that are FDA regulated. So we know what you're getting, we know the vehicle it's in, it's the right vehicle for absorption.
Okay.
So that's what I just wanted to clarify, because people I think get confused. What do all these hormones mean?
Yeah.
And typically, you're given back estrogen and progesterone, but a lot of times we do like to use the bioidentical types because we think that they're much safer. And when it comes to estrogen, getting it through the skin is safer. It's bypassing your liver. It's not affecting the clotting factors as much. So it doesn't have as much of those risks of clotting that the older hormones did.
Right.
So, hormones can be very, very helpful. They can help prevent osteoporosis. They help your hot flashes. They can help you with your sexual health. And we have over 500 receptors for estrogen in our body. So there's a lot of things. The brain fog that a lot of women complain of, it helps with that. So it can be very beneficial if you write the candidate for it.
Mm-hmm. But it really should be after menopause.
Once you've stopped your periods. And we do, so the blood test that I mentioned for hormones, I'm not saying we never check hormones, we do. Sometimes we check something called FSH to see where the level is, to know if you are done with your period. Someone who's had a hysterectomy, for example, doesn't know if they're menopausal or not yet. So we do check the hormones, but we don't really check it in the way that these designer hormones are created.
Right. Yeah, that makes sense.
Yeah.
So something you mentioned, sexual health. So I know that you do a lot of other therapies and treatments as well. Would you share with us some of what you do?
Yeah, absolutely. So when it comes to sexual health, there's a lot of issues that we have to treat that can come about. So one is a libido issue, with just the sexual drive being low. And women's sex drive is very, very complicated, and there's many factors that can play into it. And that could be a whole other session, 1 hour discussion about that. But that there are two new FDA approved medications actually to help with something called HSDD, which is hypoactive sexual desire disorder. And there are two new medications for that. So you have to be the right candidate, and your doctor can figure out, if you're a good candidate for those. Testosterone, sometimes we do give through the skin. That is the one hormone that sometimes I do prescribe compounded because it's not available for women. There are lots of studies on testosterone and the benefits of testosterone in women. Um, and unfortunately in the US, it's not approved. So you're stuck with either compounding, having it made in a compounding pharmacy, or using a medication that usually for men, but at a different dosage. But it'd have to be, out of pocket expense. Insurance doesn't cover it for women. But sometimes we use testosterone to help with libido, and it's very helpful. And we always try to make sure women are in the right range after they're being supplemented. So we do check testosterone levels for that. You might have heard of pellets. Some women go get hormone pellets inserted, and those are not safe either because they're not regulated again. You might get too much. We have women come in with too much testosterone, and now they look like a middle-aged man. They have balding, their clitoris gets enlarged, they have acne and hair, and it's a mess. So it's better to use the transdermal through the skin that we can titrate.
Okay.
That's another thing that can help with drive. Yes.
For 1 second, because just so people are clear, so to know how much testosterone you have, it's just a simple blood test, right?
Yes.
And you guys and you or your doctor can do that. Okay, I just wanted to clarify.
Really, we check it just at a baseline to make sure before you put someone on testosterone that they don't have high levels, and then you do monitor afterwards to make sure you're staying in the right range for a premenopausal woman, not in the male range.
Right.
Then you can have other side effects that are sometimes your voice changes. It's not good. Unless you want to change to a man, then that's a different story. But
right, and that's intentional, right?
So those are some of the ways we address libido issues. Another factor that plays in a lot with sexual health for women are the changes that happen in the vagina. So when you're aging, your collagen is going down. After menopause, women lose a lot of volume and collagen in their skin. But the same thing happens in the vagina. You lose when the vagina and the vaginal tissues, and also the tissue lining the bladder and the urethra, are starving of estrogen. They start changing, and you get symptoms such as dryness, sometimes just irritated. Women feel like they have a yeast infection, they have irritation, burning, and sex can become painful and not enjoyable. Obviously, if it's painful, you're not going to enjoy it, and that's going to kill your libido just off the bat.
Right.
And I have women coming in, I haven't had sex in 2 years. Now help me. That happens a lot. So there are many ways to treat the vaginal changes that happen with perimenopause and menopause. Sometimes we give topical estrogen or other hormones vaginally that are completely safe. These are different than the other hormones. They do not cause breast cancer, stroke, heart attack, and blood clots. Very, very safe. We also use a laser, a CO2 laser. A common one, the one I have in my office, is called the Mona Lisa Touch. And it's a CO2 laser. It sounds terrible, but we do it in the office, and it's pretty much pain-free. We laser the vaginal canal and also the opening of the vagina. And that helps stimulate the same way that it happens for your skin.
Right.
Collagen production. It improves the elasticity, which is the stretchability of the vagina, and it improves the lubrication. It improves the ratio of cells in the vaginal skin that produce lubrication. So it really, really helps make painful sex much more comfortable. And I've been using this for over 5 years. I was one of the first doctors in New Jersey to start using it and offering it to patients. And vast majority of patients have had really, really good results with it. That's awesome. You have to maintain it like you do anything else. You have to do touch-ups every year or so. but we do it in the office, and it works really, really well. And sometimes we use the laser and a hormone cream vaginally, depending on the patient, how many symptoms they have, how well they respond to the treatments. Sometimes we use both, and
Right.
that works really well. And I have a lot of patients who've had breast cancer who are not allowed to use anything hormonal in their body, so they come for the laser, and that's worked really, really well.
And you said it's not painful.
No, I mean, there's a probe that is inserted vaginally that can be a little bit uncomfortable, but I have older ladies who are we call it atrophy, very atrophic, and we're able to do the procedure. But the lasering itself doesn't hurt. You think, oh my gosh, it's a laser, it's going to hurt. Just a probe can be a little bit uncomfortable in the vagina for some patients, but it's extremely tolerable. I haven't had any patients not tolerate it. And it's a pretty quick, it takes, 5 to 8 minutes to do the lasering. It's
Okay.
not very long.
Yeah, that's not bad at all.
Another procedure that I do for sexual health in the office, so women who are a little bit younger who are complaining of the opposite issue, they're complaining of feeling too loose. Maybe after childbirth, they feel like they're not feeling their partner when he's entering or he's inside, and that can cause sexual dysfunction as well. We use a device called Votiva. There's another one called Thermiva, which uses radio frequency energy. And it's again another thing that's used on the body too, on the skin of the face and the stomach to tighten. And the heat created by this radio frequency energy helps build up a little bit more collagen in the vaginal tissue, and it helps give some tightening that usually is clinically significant, that a patient feels better and able to have sex more enjoyably. That device also has a microneedling component that we can microneedle the outside. So another complaint that women have sometimes, this is more aesthetic, not functional, is that the labia majora, which is the vulva that has hair, that starts deflating and getting kind of wrinkly looking, and it loses volume. And some women don't like that, want it to look better. So the microneedling there can help tighten the skin a little bit so that there's a better appearance, and it's not so saggy and kind of sad looking.
I'm so glad that we're talking about this, because we talk about all this stuff for the face, right? Like your point. And there's a very good possibility that a lot of women are potentially having these issues, but it's just not something that we talk about as readily as we talk about, our laser treatments of our face or the microneedling of our face, right?
Yeah.
So I'm glad to hear you share all of those different options with us. Are there any like supplements that you recommend women in their middle age years should be taking?
So, I mean, things like the two that I really love for supplements, if you're eating healthy and you're eating a pretty well-rounded diet, you're getting a lot of the other vitamins and minerals you need in your body. But the two things that women especially need for their bone health are calcium and vitamin D. So most people do need extra vitamin D. You're not able to get it through your diet and through sunlight. And most patients, when I check their vitamin D levels, are low. So vitamin D supplementation is very important if you're low, to maintain that levels for your bone health and other organs too, but especially for your bone health. And then a lot of people don't get enough calcium in their diet, so getting a calcium supplement can be helpful. All the other things, I mean, you can use biotin for hair, it can help. But all the other, I'm not crazy about like a whole slew of vitamins, in general. If you're having things like hot flashes, there are some natural remedies that can help. If you have mild hot flashes, if you don't want to use anything hormonal, that can be helpful. For example, there's something called Fostium Plus, which is good for your bones. It has calcium, vitamin D, magnesium, vitamin K, all of which you need for bone health. And it also has something called genistein, which is a plant-derived phytoestrogen. Phytoestrogens are substances that mimic estrogen in your body. So this one, it does not affect the receptors that cause breast cancer and uterine cancer, but it helps for your bones. So that's added and it helps your bones. As a side effect, a lot of women on it also feel like their hot flashes are better too. So that's something helpful. There are other supplements by a couple of different companies that sometimes I prescribe that help with some symptoms of menopause, whether it's PMS or hot flashes, and they can be helpful. But other than that, I think calcium and D and eating a healthy diet are really the most important.
Right. And moving your body, getting that exercise, and
Yeah, for sure.
drinking water, I'm sure you would, add in there.
Yeah.
All the things we're supposed to be doing, right?
And don't forget that after menopause, women, the number one killer of women is not breast cancer or gynecologic cancers. The number one killer of women is heart disease.
Yeah.
We don't think of that. We think of men. We think of like an old man having a heart attack. But it's really important to do all these other health things for your heart, keeping your cholesterol low, preventing diabetes, or if you are becoming diabetic, controlling that, not smoking, doing exercise, cholesterol, blood pressure, all those things. You want to keep an eye on those so that you don't have heart disease, after menopause.
Yeah, that's so important. I mean, believe it or not, it just feels a little full circle right now because when I came to see you last summer and I was really not taking good care of myself. I was stressed because of the pandemic. My father was sick, and my blood pressure was through the roof. And that was scary. Like that was a wake up call for me. That was very, in a good way, that was very eye opening for me, and kind of pushed me to start to pay attention to my health. So I'm glad you brought that up because we don't often think about heart disease as synonymous with midlife women. You tend to think of it more for midlife men. So I'm glad that you brought that up. I think it's really important for people to pay attention to. So being a midlife mama yourself and with a very busy career, and I know you're taking care of other family members, just on a personal level, how do you, any tips or tricks for us? Like, how do you juggle it all? How do you balance it?
Great question, because I think we all struggle with this. As I mentioned at the beginning of this talk, that's, as women, we have such capacity for, we're so intuitive, we're very caring and nurturing, and we're very good multitaskers. So it all falls on us, which is a gift. I think it's a gift to be able to provide that to others, to our children, our families, and society. But at the same time, we have to make sure that it's not affecting us negatively, affecting our health and our bodies negatively, because we can only serve others better when we're better. So actually the pandemic, I think for us as a family was really helpful because it slowed us down. It slowed the kids' activities down. My kids are young, they're 8 and 10. It slowed down their activities. And we got to a little bit go back to the core, being together, eating dinner together, just slowing down. And, I make it a point. I'm a very quick person, maybe a little ADD. I don't know. That's why I loved OBGYN. But I had to train myself when my kids are talking to me to actually become still, make eye contact, and don't move. And because I would like wash dishes while they're talking or do this and do the next task. That's how I tend to be. But I made myself slow down, make eye contact with them. And that connection just built and they're talking to me. I did not want to ignore my kids now. And then when they're 15 and there's something really important to talk about, they're not going to come talk to me. So the pandemic really slowed us down in that way. But what I do is, when I'm at work, I'm at work. When I come home, I'm paying attention to my family. I do exercise. I was not before September, but starting in September, my husband and I do it together, which is a lot of fun to do as a couple. We come to the basement and we exercise. We had a trainer for a few months. Now we just do it on our own. Exercising helps. I pray every day. So anything that's kind of meditative, unless you just be by yourself and think of something greater. And I always just try to make sure that I'm doing some act of service. I think doing an act of service, it gets you out of you and gets you, there's nothing better, I think, for happiness than doing something nice for someone else.
I love that.
It really fills you up in a better way. And it's very freeing. And that gives me, for me anyway, gives me more enduring happiness than something that I'm doing for me. So just kind of balance in that way, if that makes sense.
Such a great point about balance, because yes, we have been talking about making time for ourselves and self-care. And, we've been stressing that so much, but it is also okay to want to give back and to want to volunteer, to want to help, because that is a lot of our, a lot of our nature is to nurture others and to help. And when we feel grateful, we want to share that with others, right? We want to spread that joy. So that's an awesome point that you made, that we can still make that as part of that. You're making time for each of these things, as hard as it may be. And it doesn't have to be a lot of time for each thing, but you're making time for your prayer and your stillness and your children and your time to give back to others as well. I love that.
And now that the kids are a little bit older, we do it together. We'll like do something service oriented together, and it's a bonding experience. It gets them off the computer and the video games, and they feel good. The last time we went, in Patterson, we helped out, my kids and I went and helped out this wonderful family who does a lot of service at a shelter, at a food pantry in Patterson, and giving out the food. And then there's this huge warehouse, and food is delivered by the New Jersey Community Food Bank and other organizations, and you help stock it away, and then you make the bags and people come for the food. And when we left, my 10-year-old looked at me, he said, "Mom, that felt really good. I feel really, really good right now." And I was like, "That's great." He actually felt that kind of rush of joy about helping other people. And so doing it together, you can combine different tasks into one.
Right.
A fun thing to do.
And it's such a great point, because you're having the connection with him, you're modeling, you're teaching, empathy, and you're fulfilling your soul too. So that's such an awesome reminder for all of us that we can include kids in it. And it's even the other day I had yoga / meditation teacher on, just made me think of it. Even that we can include, our kids in, right? Simple meditation, yoga, or and then also just getting them involved in tasks, loading the dishwasher, unloading the dishwasher, because then it just takes, I explained to my girls, like, I could spend 15 minutes up here doing it all myself, or you guys can help me, and it can take 5 minutes, and we can go either watch Wheel of Fortune or, a game, whatever it might be.
Teamwork. Yeah, absolutely.
Yeah. So,
right.
That's such good insight. So thank you for sharing that with us. All right, I think we covered it all. Let me just see if there's any questions. And anything else that you wanted to share, Dr. DeNoble?
Yeah, I mean, don't be scared of hormones.
Mm.
A lot of benefit, a lot. You have to be the right candidate, of course. If someone's a smoker and they've had a heart attack, I'm not going to put them on hormones. But and when you do it, within 10 years of menopause, when you start hormones, not after. And that was the problem with the study. It looked at a lot of the 2/3 of the women were over the age of 60. So we don't start women on hormones at age 65, right? If you're going to start it, you're starting it, mid 50s, early 50s, around that time. Okay. When you look at that population, there is protection of heart disease. Actually, it prevents heart disease, and it can lower colorectal cancer. Obviously, lowers fractures related to osteoporosis when you're older. So overall morbidity and mortality is greatly improved for women who are on hormones. So, and they can really help a lot of things. And keep up your vaginal health, because discrepancies in sex life in couples can be a big problem. It can cause a lot of strain in a relationship, and sex is a really important part of life. And if you're finding a struggle with whatever the issue might be, whether it's drive, libido, or pain and functional, then it can definitely be fixed. It's not talked about, but there's many, many great treatments, and you can talk to your doctor or come see me or whoever and discuss the options, and it can really help to kind of make that issue better.
That's such another good point too, because I mean, as we're struggling to juggle our kids and our work and only have so much time for our relationship, then to throw in, sexual struggles in the mix makes it even harder. And then, you could drift further and further apart. And that's a really awesome point that you brought up. And so everybody, everyone that's a VIP, whether you've gotten your swag bag or not yet, there's a discount card in there. And then today, when we do our exclusive giveaway, Dr. DeNoble has so generously offered one of the Mona Lisa treatments that we'll be raffling off this afternoon. And then I will also share Dr. DeNoble's website and information on our Facebook group. So make sure everybody keeps checking in there. And again, I just want to thank you for taking the time to come talk about, because sometimes this stuff isn't really talked about. So I thought it was important to get it in here, especially with this audience of midlife mamas.
Thank you. Thank you so much for including me, and enjoy the rest of the session.
Thank you. Thank you so much.
Bye.
All right, it is 3:34, so I am going to take a little break. So should you, we will be back at 4 o'clock with moi. So I will be talking a little bit more about what I do, the Peace and Plenty program. and sharing that information with you. And after that, at 5 o'clock, we have the giveaways. Finally, the moment you've all been waiting for. So we have giveaways for all of the attendees for the conference. And then we have an exclusive set of giveaways for those of you that signed up to be VIPs. It's not too late. You still have an hour and a half until I spin that wheel. If you're interested in switching over to VIP, you'll get access to each one of these sessions forever. You'll get the swag bag, and you'll be entered into these giveaways. So you just go to the original link where you registered for this and just hit yes to be a VIP. Any questions or comments, drop them in the chat, drop them in the Facebook group. I'm going to take a breather, and I will see you guys back here in about 20 minutes. Adios.